Hello, my name is Dr. David Marlin. It's clear, whatever way we look at it, that the impact of COVID-19 has been really extensive. And this varies whether we are looking at the effect on poverty or mental health, education, and how this impacts the economy and things like tourism. And what we were interested in is what the effect was on horse owners and horse welfare. The potential impact that the COVID-19 pandemic could have had on horse owners would include reduced income. So as a direct effect, potentially people who generate their income from horses, such as feed businesses, people who are coaching, people running competitions, people who have retail outlets. And then there's the indirect effect from people losing their jobs, having reduced income from reduced opportunities to earn money, and therefore that would have a direct impact on how much they could spend on their horses. Another potential impact would be people's ability to get access to their horses. For example, if those horses are not kept at their home. Potentially disruption of or interference with access to services such as vets and physios or dentists, and also potential disruption or interference with the ability to get feed and other essential items. We chose to look at 3 different regions, and this was the surveys were conducted in late March, early April, around very similar times. In the UK, this was launched first, then in North America, and a few days after in Australia and New Zealand. At the time that we launched these surveys, the different countries were at sort of different stages in terms of how they were being affected by coronavirus and the number of cases. If we look at the 3 different regions, we can see that Australia, New Zealand were running at around 240 cases per million head of population at the time of this survey, and they had just started to plateau. The UK was running at around 3 times as many cases per million head of population, and we were on the early phase of the climb in cases, and we were running, as I say, worse than Australia and New Zealand, but behind the US. So at the time of the survey, the US was on the early part of the curve, but was seeing more cases per million head of population than the UK. And we can see, of course, as if we look at now the right hand side of these curves, the Australia New Zealand is still on a second phase, second wave of infections and a steep increase. The UK has sort of nearly almost plateaued, and the US is also on a steeper trajectory than the UK. So in terms of at the time of the surveys, the USA was worse than the UK, which in turn was worse than Australia and New Zealand. But if we look at now, we can see that we have a very different picture in the fact that the USA has a very high number of cases, UK moderate, and Australia, although it's on an increasing trend, the case numbers are still actually fairly low, and this is data from Worldometer. So in the USA, we've seen a 13-fold increase from when the survey was first conducted. UK is a 6-fold, and Australia, New Zealand is a 3-fold increase. So the surveys that we disseminated were with the SurveyMonkey platform. There were 17 questions, of which 16 were closed questions, multiple choice type questions, and one was a free text box which said any other comments you would like to make. and the distribution was mainly via social media. The closed questions for demographic factors were asked about the region, how many horses were owned, if the horses had any existing medical conditions, and how they were kept, for example, at home or at livery. And if at livery, what type of livery. The second set of questions focused on the impact on horse management. If their horse management had changed as a result of the COVID-19 pandemic, if any changes made were voluntary or enforced, if they had been advised or told to rough off their horse. That's a term used when you have a horse that's in work and essentially you turn it out. If they had experienced changes to professional services such as vets, farriers, dentists or physiotherapists. And impact on horse facility management, the third set of questions. So if social distancing measures had been implemented on their yard or not, and to identify which other control measures had been put in place. And finally, questions about the impact on owner interaction with their horses. So whether they had themselves reduced the number of times a day they visited their horse, whether or not they were still riding, and if they felt the pandemic would result in their horse having a period of confinement. So finally, any ongoing financial implications of the pandemic on providing for their horses' care, so whether they were concerned about their income and loss of income in terms of being able to care for their horses. So we had these areas that we asked about, and as I say, financial implications such as livery costs, feed, forage, farrier bills, veterinary bills. These are the number of respondents for each of the three regions. As you can see, we got the most responses from the UK, a reasonable number of responses from North America, and about 1,200 from Australia and New Zealand. There was clearly an impact on how horses were kept, and for horses that were at home, most of the respondents felt there was no or slight impact, and the major impact was mostly seen in terms of horses that were at part livery or full livery. This is for data for the UK. If we then look at the data for North America, again we see a very similar sort of pattern with no impact for being the main, over 70% for horses kept at home, and only sort of somewhere around 10 to 15% major impact for horses kept at a boarding facility. So remember, this for the US is fairly early on in the pandemic. For Australia and New Zealand, again the same pattern. Very few people experience any impact for horses kept at home, and about sort of 20% for horses where they were DIY or part board. So when we look at this overall, we can see that actually in the UK, we had the highest number of owners who felt there had been a major impact in terms of their horses, and those were the ones that were at part livery or full livery. In terms of Australia, New Zealand and the USA, there was less perception of a major impact, at least at this time in early April, late March. When we asked about people whether they were still riding, in the UK, around 66% were still riding, and about a third to a half were riding less for horses that were kept at livery, and 45% were riding with constraints imposed upon them. And people reported changed riding activity. So for example, no jumping, avoiding young horses, and schooling, not hacking. In North America, there was quite a range from 44 to 84% who said they were still riding as normal. Again, those that were riding less, 44 to 61%, were on half or full board. So that was very similar to what we saw in the UK. And again, around 28-37% were riding with constraints, and that's similar to the value of 45% for the UK. But at the time, New Zealand, Australia and New Zealand were not reporting really any real differences in their riding. So if we look across here, we can see that in terms of the controls being undertaken by different establishments, the greatest percentage was in the UK, but again there was quite a wide range, but up to 41% of establishments were allowing essential visitors only. Again, when we look at, for example, requirement for hand washing, it was around 50%. In North America, it varied between 12 and 49%. And New Zealand, Australia, again, quite a wide range. In terms of time that horses people could access, again, generally more people being restricted in the UK. The establishment of buddy groups, again, much higher in the UK. So protective wear, North America actually and New Zealand, Australia seem to have, there were a greater number of establishments that were requiring this, or people who were experiencing this. So quite a range, and as I say, possibly the UK seems to be perhaps more stricter at this time, or that more establishments or people were experiencing that they were being required to undertake these measures. In terms of people's perception of the effect of restrictions on horse health, for those that felt that this was already taking effect, in the UK it was 35 to 60%, but in North America and New Zealand, Australia, we were seeing a lower percentage of people perceiving that there was an effect of restrictions on horse health. And it may be that in the UK, vets and physios and dentists were required to moderate even at this time how they were interacting with clients through government directions, which may not have been present at that time in North America or New Zealand, Australia. At the time, people who perceived that there would be an impact on their horses through their access to veterinary and other related services, only 15% said now, but 85% expected that to be soon. Reasonably similar for North America, and perception in New Zealand, Australia was that there was a slightly higher immediate impact, but similar to North America actually. But people in North America and New Zealand, Australia were slightly less, a percentage of people were expecting a short-term, more aggressive impact. In terms of how worried people were about COVID-19 and their ability to provide for their horses, in the UK, 33% were currently worried, and a further 25% were worried it would impact on the future. In terms of North America, 44.5% were worried that the impact would, the pandemic would impact their financial ability to provide for their horses. And in New Zealand, Australia, 42% concerned. So generally around sort of a third to just under a half were worried about the financial impact. And of course, this was early on in the pattern of the pandemic. Looking at thematic analysis, this is, first of all, we've broken this down by country or by region. So the 4 themes that came up this is really from the open text question at the end. The 4 themes were horse exercise and management, horse health, horse welfare, and human health well-being. In North America, it was exercise and management, horse welfare, and personal human impact. And there was a wider range of themes expressed in the Australia and New Zealand, which is interesting considering that was only about a quarter of the responses of the UK, a quarter of the responses of North America, and about 1/6 of the responses numerically compared to the UK. And people were sort of more interested in, for example, having better guidance provided. That wasn't mentioned as a theme in North America or the UK, for example. So, and concern about how riding was being, or equestrian was being managed or controlled compared to other open air, fresh air sports. Now, many similarities, but also some differences. So New Zealand more restricted than Australia. Australia were more concerned about future availability of food. And of course we can understand this given some of the problems that have been Australia has been facing more recently in terms of very severe high temperatures, severe drought, and bushfires. US concerned about human well-being and economics, and UK concerned about risks such as the effect of increased stabling, such as obesity or laminitis. An interesting one was peer pressure via social media. People were concerned that they were being seen to be doing the right thing. So the common themes that we saw really across all countries, perhaps not surprising, were horse health and welfare and horse owner well-being. And I think this is a theme in general that is become more prominent throughout the COVID-19 pandemic, is the effect on people's mental well-being. So what if we were going to give recommendations? I should mention that in the UK in particular, we have shared, obviously this is anonymized data, there is no nobody's identified, but we have shared this data with government organisations, with charities such as the Royal Society for Protection of Cruelty to Animals, the British Horse Society, the World Horse Welfare. We've shared it with our national equine veterinary body, with British Equine Veterinary Association, and other potential stakeholders who would be able to use this information to help understand and manage the potential impact of COVID-19 on horse welfare and horse owners. So we feel there is need for simple and clear guidance to support owners, because there are a lot of myths going around about that for example, you can catch COVID-19 from your horse. Official and unambiguous guidance from the government and other non-governmental bodies, guidance on how to access financial support, support for equestrian charities, because we know at this time all charities are suffering a downturn of income, equestrian social support networks, helping equestrians to support one another at what is a very difficult time, and support for key workers to manage their horses. So what are the next steps? We are clearly seeing ongoing impact. We know that in Australia, just recently, people in the state of Victoria have been fined for going out to feed their horses. And clearly, if people are not allowed to go and feed their horses, this is a major welfare concern. And it's something that horse owners are going to do. In terms of the UK, we are seeing further easing of restrictions on the general population. You are now allowed to have weddings of a moderate number of people. I think beauticians have just been allowed to reopen. So we're seeing a gradual easing, and we've seen equestrian competition restarted, some of which is with restricted access for spectators. But this is at a time when we are clearly still on a slight upward trend. Okay, the numbers dropped to a sort of minimum in around the start of July, but we are now sort of approximately double that daily case rate from what the minimum was. So we are still on an increasing trend. So that's worrying, because we are seeing, as I say, more and more easing of restrictions. And then finally, in the US is obviously in a very different position, possibly more severe than anywhere else, although it's hopefully there is a downward trend in the number of daily cases. But the US, North American, or this is the US situation, is complex because there is state by state regulation rather than regulation at a national level, which we have, at least we have that in the UK. I'm not clear in Australia whether it is state by state different regulations. But as I say, it is complex in the US, because this is a table on the right, just is one page of a table from the US Equestrian Federation showing what you can and can't do as a horse owner or organizer in different states. So the final next step for us is to relaunch this survey. This was, as I say, launched at the end of March, start of April. So we are now sort of end of April, end of May, end of June, end of July. We are end of August. We will be 5 months into on from where we were, and each region is in a different position now as well. So we will be relaunching this to try and understand how the position has changed and potentially what steps need to be taken, or what we need to be concerned about going forward in terms of horse health and welfare.